Hello, hello, hello. How are you? Okay, so I did put this poll up and only two people answered. So if you can take a moment and answer that poll before I take it down, I want to know how you're doing. And I just found this option, this feature. So I want to see how it works. So I appreciate you. And I'm going to take it down in 5 seconds. Five, four, three, two, one. All right. So we only got two responders. Maybe we just don't know how to use it yet, but it's okay. Thank you for the two that figured it out. And I'm ready to get started. How about you? Now I'm going to remove this poll so I can see if you all can hear me. How is my sound? Thank you, Ms. Mills. Yes. Okay. So we're ready to roll. Let me see if Mr. Sandeep is here. I don't see him yet, but we're going to keep going. All right. So welcome, welcome, welcome to week 13. We only have three more sessions. So for all of you that stayed the entire time, hats off to you. To my team, Mr. Sandeep. I don't know if he's here, but he'll be here. Ms. Mills, Miss Haley, Miss um Wait, there's Miss Dolly. Miss Dolly is kind of moving over into another space, but she was here for a good bit of it. And I just want to say thank you to my team. I want to say thank you to the interns, Miss Beth, Miss Star Wars girl. I don't know. Sometimes Case comes in. Hello, 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 and thank you, thank you, thank you. And I just want to say hello to all of you. I'm going to be shouting you out momentarily, but I rock with you all. All right, so let's go. And if this is your first time here, let me know. And if it isn't, I'm just going to tell you very briefly. Oh, I don't know how to take this off. Let me see if I can try and get this off the screen. There you go. All right, so I'm going to try and just let everyone know the purpose real quick. So, the purpose of this class is not to instruct. So, don't expect me to go step by step by step on how to solve a scenario. Most of you already know the logistics of how to do it in that process. So, we don't want to be repetitive, but my goal is to hold you accountable, be more accessible to answer your questions. I want to review what you should already know and give you tips on how to navigate your course. And finally, I think there's one more, and that's really, really important. This is point out key guidelines. This is what separates the coders from the test takers. I'll tell you about that a little later. All right. All right. So, announcements, it's still the same. Nothing outside of what we've been saying every week. Just, try and come to some of the other free courses that we have. We do on Friday, Mr. Sandeep will be teaching the mastery classes, the CPT mastery classes. So if you want that step by step, Mr. Sandeep is him. And don't forget, inside Discord, there are classes. You have your test taking anxiety, as well as your IMTAP. That's interactive medical terminology in anatomy and physiology. So definitely take advantage of it. If you're new, a lot of people say, hey, how do I get started? Just go to our website, www.amcicoding, click on YouTube course, and then it will bring you right here to the page. And what you really need to focus on is this, the enrollment form, as well as the syllabus. So first, complete the enrollment form. It's a short form, then your syllabus. And then that is what you're going to need. Your syllabus is your course. So you'll follow that syllabus in the order presented. Now, also on your syllabus, this is how you RSVP for classes. So as you see, this is week 13. You would just click here, it will bring you to the YouTube page where you can go ahead and RSVP. You just click on that button where it says notify me. That's how you RSVP. And also give us a like up. Yeah. And thank you in advance. All right. And so if you want to be notified about this class or any other videos or lectures that we might have, go ahead and click on that bell. Yeah, that's a notification bell. All right. So what do we need for today? For today and only today, you're going to need your CPT professional. And I do recommend if you have the MCG, definitely use that as a reference. Also, Discord. A lot of people like Discord because the instructors are in Discord. They're there every day, there to answer your questions. The interns are there as well. And there's Miss Case. Hello, hello, hello. Did I say hello, Miss Haley? I'm not sure, so I do want to make sure I said that. All right, so um, on your syllabus, you can find the instructions on how to join Discord. And what's the advantage? Well, you have some additional resources in there like pay, you know, prep questions or practice questions. Also, you have access to the AMCI instructors and interns. There are private classes in there, test taking anxiety, I'm tap, and Friday night lives on Friday. So definitely follow the instructions from your syllabus. Does it cost minimally? I think it's $2.99 per month. So it's a really good for that minimal amount, you get a lot for it. Also, so enough about Discord. We're switching gears. We're switching gears. Now we want to talk about what are you going to do after this session? So I want to know how many of you, and type in the chat, are planning on taking the CPC exam. Go ahead, type in the chat. Let me know. If you're taking your CPC exam, let me know. Um, oh, so Chichilin, she has a question. I'm going to answer your question. She's taking her exam tomorrow. I'm going to answer your question. How about when the surgeon operates and is doing wait, I lost you. One second. Is doing two capacities, the surgeon and the radiology. Do we use the 26 or no? You do not. No, because it's not the same. You do not append the 26 modifier. Remember, that 26 modifier is for the professional services. Just a small, like reading of the report or, reading the film to generate a report. When you're doing surgery and that radiological procedure is a part of the surgery, it is nothing like reading a report. They are engaged in that surgical procedure. So that is called supervision and interpretation. Um, so it's S&I, okay, radiologic S&I. Think about that. Let that marinate, okay? So you're going to do well. I've said it. I'm claiming it. All right. So a lot of you are taking the CPC exam. This is what I recommend. When you finish this course, I do recommend that you just go ahead and attempt those questions if you have the MCG because you got a lot of practice questions. But here is the big kahuna. The AAPC, they have practice questions, and from their website, you can go ahead and purchase them, and it's $79.99 for a bundle. It's called ABC, so it's 3 exams. And let me tell you, those exams mirror the actual exam to me in texture, that's level of complexity, as well as there is a built-in tool, evaluation and management tool. That is the same tool you'll be using when you take the exam. So this is highly recommended after you complete your instruction. And I'm going to tell you, when you complete this instruction, that exam, you're going to slay that exam because we prepare you here. Somebody tell me. Well, I'm only talking about the CPC today, and tomorrow, excuse me, next week I'll be talking about the CCSP. But if you are going for your CCS, this is just a part of it. The CCS is a combination. You have to have already mastered all of the elements of the CPC. When you get to the CCS, you have 5 domains that you need to prepare for. So this is good if you're planning on taking the CCS, but you have more work to do. You have about 9 more weeks of work. All right. Yeah, so if you want to master the CPT guidelines, this is where you belong. All right, so this link to these practice exams was kind of difficult to find. So I did put it on your syllabus. You can find it here. Click there. Okay, so from your syllabus, we're under the resources, click number 7. All right, sorry to take up that much time. Another thing, the evaluation and management calculator, if you all are ready to test, then you should know what evaluation and management is. We haven't discussed it yet in this class, but those are doctor visits, and this is how you score. And now it's done electronically. So we'll be reviewing that. And that this link is also on your in your on your syllabus, and I put it on late, so it's right up underneath the other option. So it's number 8. All right. So now this is week 13, and what should we know? What should we have completed? Well, we should have completed week 13 in our on our syllabus, right? And this week it's urinary male female systems, but I did add digestive to this. So if you've done digestive last week, we're going to kind of review it this week. And if you didn't complete all of it, it's okay because at least you're here and you're going to learn something. All right. Now, want to just draw your attention to these playbacks. Anytime it's green, it's a playback. And when you click on it, it will take you to your playback videos. Now, I want to remind you, don't study directly from the playback. Don't take the class from the playback because these are just playbacks. Your syllabus has all of the content that you need to complete. All right. And just so you know, just so you can identify, the purple and the green are playbacks of this class, not the main playback, but of this class. This is kind of the review. All right. So hopefully that makes sense. Somebody said they've been chunning for 2 days. Now that makes sense. Okay. So if you are a gold member, a YouTube gold member, and you opted to get the online course, this is what your LMS looks like. It is the exact same as this course, with the exception we did include some quizzes. We included quizzes for each of the sections to kind of give you a little more. And all of the handouts and everything that's found in Discord, we've placed them in the LMS just to manage the learning better. That's why it's called a learning management system. And this is not the AMCI MCDC course. And this is pretty much our YouTube lectures. And people want to know all the time, can they pass the AAPC, CPC, or the CCSP just from YouTube? You sure can. You really, really can. And don't let anyone tell you you can't, because a lot of people are, and they're coming in by the droves telling us, hey, we've passed, we've passed, we've passed. So go ahead. You can do it too. All right. So now it's time to get started and let's test your knowledge. What should you already know? Or maybe be able to figure out. Welcome to our new member, Erica Dunlap. Welcome, welcome, welcome. All right, here's the first question. Generally, if a screening colonoscopy results in the removal of a polyp using a snare technique, The procedure should still be coded as a screening colonoscopy or a diagnostic colonoscopy. What say you? Go ahead, type your answers in the chat. Okay, I gave you a little time. I just wanted to know if you knew that diagnostic scopes are bundled into the surgical scope generally. And if you know that, then this is false, right? So the person came in for a diagnostic procedure and it resulted in them removing a polyp. So that's surgery. Diagnostic scopes are generally bundled into the surgical scope. And Vina D hit it on the nail. I'm not going to go too much into it right now, but we're going to talk more about that later. All right. So I do want to remind you there are tons of scopes in the digestive system, tons, and I recommend chunning this section. Definitely chun it. Don't slip on that because you're going to get a lot of stuff right. In those areas that you've chunned, it's going to make it so much easier. Okay? Now, also, the term separate procedure is key. How many of you know what separate procedure is? Like, if you don't, I'm really interested in the people that don't really. So, how many of you don't know what separate procedure is? Go ahead, type in the chat. And while you're answering, I'm going to continue. All right. So, we got another question. During a kidney transplant, now we're moving from digestive and we're moving on to urinary. During a kidney transplant, the following surgical procedures are not coded separately: removal, backbench work, and transplantation. True or false? What say you? Okay, good job for all of you that answered. Fantastic job. I'm going to pick up the pace, and the answer is false. Indeed, when you are coding kidney transplants, you code separately that removal, the backbench work, as well as the transplantation, because they also all have their separate codes. So just to make sure you're aware of that, now we're going to move on to mail system. When coding circumcisions, the code selection is based on if the procedure was via an excision or device, like a clamp. What say you? Go ahead, put your answers in the chat. I know, Miss Haley. Great participation. Good job, Brenda. B. Frazier. Starry. Chichi. I know I'm saying your name wrong. I apologize. Sarah, I'm glad you answered. Jackie, I'm glad you answered. Le, uh, Latry. I apologize. Latry. Delicia. Patricia. Outstanding. C. Primo. Outstanding. Yvonne. Let's go. If I missed you, I'm going to get you next time. Okay, love and light. Outstanding. The answer is true. Absolutely. Good job. All right. Female system, our last system. What do you already know? CPT guidelines prohibit reporting a total abdominal hysterectomy following a delivery. True or false? What say you? Okay, I got it. It's Chi Chi and Laterre. Good job. Good job, Jackie. I missed somebody and I want to definitely shout you out. It was a couple of you. Let's see. I want to shout you out, Lucky, Melissa Anderson, and Janet. I missed you before, so I apologize. Good job, good job, good job, everybody. And the answer is false. Yes, that's false. You can report a total abdominal hysterectomy following a delivery. Absolutely. And there is a specific code that you can use. There's you if a C-section takes place, there is a a hysterectomy code for that, and then you can also code for the hysterectomy from the hysterectomy session if the it's following a vaginal delivery. So the key is if it's a cesarean, I hope I'm not saying too much. If it's a cesarean section, you have to use the specific code in the female system, female section, or in the section where the delivery is. And if it's a vaginal delivery, you go ahead and use the traditional hysterectomy codes. So yeah, you can code that, right? All right. So let's go ahead and talk about some things. This is what you should already know. When you are coding for urinary, male, female system, and digestive, you should be familiar with those general CPT codes. Earlier, as you can see, that separate procedure guideline keeps coming up. So you should know it because it is applicable to digestive. It's applicable to every single surgical um, section in CPT. So you got to be familiar. And in general, just be familiar with the specific guidelines for these respective sections. In my personal favorite, be familiar with the layout of the sections of CPT. How many of you feel comfortable with flipping to a page? Like if I say go to the female system, you can kind of find it without looking at a tab. How many of you feel comfortable doing that? And if you don't, say I don't. But I tell you one thing, the more you practice, the more you code, you're just going to do it organically. Absolutely. All right. So somebody said, hey, not yet, not yet. But the more you're flipping through there, of course you're going to know where it is eventually. Okay. Yvonne says she is. Delicia said somewhat. That's what I'm talking about. Someone said they tab it. Definitely. If you want to tab it, go right ahead. Definitely do that. But you still should be that familiar. That means that you've gotten the practice in, or it may mean that. It strongly suggests that you got a number of hours in, that you've practiced enough and you're almost likely to be ready to take your medical coding exams. All right, so this is what the general coding guidelines look. It's the green pages. And yes, I'd say of all of these guidelines, the separate procedure is what you need to master. And yeah, it looks like it's a lot. It isn't. You know what, Vina? Vina clarified it really well. Vina D said, hey, it's just, generally when you have two procedures and one of them is a separate procedure, it's bundled. If it's related, I'm adding if it's related. Okay. All right. So that's that. And these guidelines apply to 10,000 through 60,000 code series. So integumentary through medicine. Indeed. All right. So now let's take a look at the anatomy really quickly. Your digestive system. This is taken directly from your CPT. And my advice, label it. Label it. In our instructional lessons, we label it. We give you a short anatomy um, section, session right before the CPT. Definitely label these pictures because you can take this with you when you take your exam, and you will have some anatomy. Not a whole lot, but you can always go to the picture if you have a question, right? All right. Also, the urinary system is pretty simple. You know, make yourself familiar. And this, again, is taken from no, that's not taken from your CPT, but you get the picture. And the male reproductive system, as well as the female reproductive system. Just have a general idea of the anatomy. And if you don't, go ahead and use the images in your book. All right. Another thing, make sure you're chunning. I saw some people saying, hey, I'm chunning. Very, very good. I think you should chun as you go, chun as you're studying, but some of you prefer to wait later. There's some advantages for that as well, because that could be a way to kind of refine and solidify what you've already learned. All right. Also, I want to invite you to join the Chun group on Facebook. Go ahead. That's where you see your peers chun. If you are a gold member, you have the instructor's chun in your class. If you're gold Discord, it's also in Discord. Only for gold people. All right. Someone said chun has been the best. I'm telling you. I'm telling you. And this is a quick overview of chun. Basically, it's circling the families and corresponding parenthetical guidelines. Also, so chun it all, circle it all and highlight your the language after the semicolon, the identicode language, all parenthetical guidelines, and any language at the code level that's in a parenthesis, and it tells you that you need to select two colors, and this is how you divide it up. Also, underline anything that needs to be emphasized, the language within a family or standalone code that needs to be distinguished. And finally, notate. Notate. If not present, notate the red heading, the blue subheadings at the top of the page. So if it's not at the top of the page, it's on the previous pages, go ahead and write it so you don't have to turn the page when you're taking your exam. You know exactly where you're coding from. All right. Also notate at the bottom of the page the AMCI FTRs or your guidelines that are pertinent to the codes on that page. And finally, notate at the code level any pertinent keyword to the code or family. Now, let's go ahead. We got a question. This is our scenario, and this is digestive system. And I'm going to just kind of take a pause because I kind of transitioned from chun to this. So I'm going to just take a little break. All right. Now we got a scenario. Of the following answers, which best describes the encounter? A, 45385, B, 45378, C, 45378, 4538551 modifier, D, 45385, 4537851 modifier. A 58-year-old patient undergoes a screening colonoscopy. During the procedure, the physician identifies and removes a single polyp in the sigmoid colon using a snare technique. The colonoscope is advanced to the cecum and the procedure is completed without complication. Okay, coders, what say you? Go ahead, put your answers in the chat. All right, we got a few of you answering, and I love it. And welcome, welcome, welcome to our new member, M. Greenlaw. Welcome, welcome, welcome. Okay, everyone. No, someone says, no black ink allowed. That is no more. They have gotten rid of that rule maybe about 3 years. So we're doing our best to scrub it. So thank you for saying that. Thank you, thank you, thank you. So there are no restrictions in terms of ink for the CCS exam. All right. What say you? A lot of you said A, a lot of you said B. Let's see what's going on here. Well, if this is your first time here, what we do is inventory. That means we write down all the diagnoses, signs and symptoms, treatment, and procedures in the order presented. So this patient has a screening colonoscopy. And during that procedure, the physician identified a single polyp and removed it in the sigmoid colon via snare technique, and the colonoscope was advanced to the cecum. Does anybody know why that's important? Why is it important to say that the colonoscope or colonoscope was advanced to the cecum? Anybody know? That's right, Miss Vina. And you know what? Vina is a new intern. I want to shout you out and say hello. Welcome, 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 Miss Vina. Miss Vina D recently passed her certification exam. Not only did she knock out that exam, she knocked out the MCDC course. Yes, she did. She just put on her boxing gloves and said 1, 2, and she kept us on our toes. We love all of our students and we loved every moment of it. Vina, thank you, thank you, thank you. That's right, Miss Haley. That's right. Okay, so the reason it's important, that's right, Melissa. Melissa says the reason to document that the colonoscope was advanced to the cecum because it lets you know that that procedure was completed. Yes, and Brenda said it too, or B. Frazier. I'm just calling you Brenda. B. Frazier said it too. Yeah, so that scope's got to go all the way through in order to be a complete colonoscopy. That's right. When it reaches the cecum, it's a full and complete colonoscopy. If it's not, then it's not complete and you have to append a modifier. Oh, I'm saying stuff a little ahead of time. All right, so what happened was there was a diagnostic scope, and that diagnostic scope also was accompanied by a surgical scope. Anytime you perform a procedure, it's surgical. So, what do we do? Well, I'm going to go grab the guideline just to kind of, remind myself. And the guidelines are here, and it says number 2, diagnostic scopes are bundled with the same surgical scope. That means if they just left the scope in there and carried out and just maybe inserted a tool like a snare tool and carried out that procedure, they're not removing anything. So if it's in that same surgical scope, it's bundled. And we're going to go ahead and get rid of it. And this is generally. So we're going to get rid of the screening, the diagnostic scope, and anything that's coding for the diagnostic scope. We're going to get the diagnostic scope is 45378, and it's at B. It's also at C. They're coding both the diagnostic scope and the surgical scope. Also at D, they're doing the same thing, just different techniques. So the answer is A. Off bat, it's A. Now there's something else I want to show you. All right. So if you didn't know this guideline, this is how you can answer the question. When you look up the code, if you check the separate procedure in the parentheses, that will tell you. You check if it says separate procedure, then you need to apply the separate procedure guideline. And 45378 has a separate procedure in the parentheses, and that's a guideline, right? So it says separate procedure, so therefore you cannot code a separate procedure with a related, more complex procedure. And removal of a snare is a related procedure to the diagnostic procedure. It's related. It's in the same family. You can't even code it. We just know that. But if you didn't know that, you can just look at the parenthetical guideline and it tells you do not report 45385 in conjunction with 45378, right? So it's telling you that. So train your eyes to always check for separate procedure, always, any procedure. Anytime you have more than one, if one says separate procedure and it's related to the other, it's bundled for this exam. All right? Absolutely. Does that make sense? Go ahead, type in the chat. Let me know. And for those of you that got it correct, outstanding. And I love the fact that you all are really, really showing me that you have some advanced level understanding, like knowing that that colonoscopy's got to reach the cecum, like Sheila said. Outstanding. Good job, Yvonne. Thanks for letting me know, Star Wars. Thank you, Sheila. All right, we're going to move on. We're done with digestive system. Let's go ahead and turn our attention to the urinary system. And if you can, try to answer this question before I finish reading the scenario. All right? Of the following answers, which best describes the encounter? A, 52000 cystoscopy. B, 52005 cystoscopy with ureteral cath. Ureteral. Sorry about that. This is bad. My boss would just eat me up. What do you mean you don't know how to say that? Ureteral catheterization with or without irrigation, installation, or ureteral pylography. 52310 cystoscopy with removal of calculus, 52332 cystoscopy with insertion of indwelling ureteral stent. A 64-year-old patient undergoes a diagnostic cystoscopy for hematuria. During the same session, the physician performs a ureteral catheterization to obtain a urine specimen for diagnostic testing. No biopsy, no fulguration, or therapeutic intervention is performed. Okay, coders, what say you? Yeah, you all just did that like pros. Just go on through. It's no trick. And coders, I'm going to tell you, this exam have no tricks. And if you're listening to our videos on YouTube, from the video, the catalog, one thing I dislike about those videos, they keep saying a CPC exam trap. There are no traps, none, none. It's a measurement of your guideline knowledge. And if you don't know guidelines, then yeah, it's a trap. But wait a minute, aren't we supposed to know guidelines? Right? Okay. Back to the scenario. Outstanding job, everyone. Outstanding. Yes, let's go ahead and inventory. We had a diagnostic cystoscopy. The patient has hematuria, blood and urine, and a ureteral catheterization took place. And they did it just to kind of capture the urine for whatever reason. And if we go in and we look at the scopes guideline, is very similar to the scopes in the digestive system. Diagnostic scopes are bundled with surgical scopes unless removal and reinserted. So that didn't happen. And you know what? Our answer is B because this describes the procedure. Patient had a had a cystoscopy with your ureteral catheterization. So that's it. The other ones, A is your diagnostic procedure. C is removal of calculus, and D is with insertion of a stent, and that's just a catheter. That's a catheter too. Just to let you know. So the answer is B. And the reason it is B is because it's using the same language as the scenario. So even though a catheter and a stent, a ureteral stent and a catheter are the same, B is saying the exact language. So you got to go with the answer that's more closely aligned and has more keywords as your documentation or scenario. All right, so I wanted to say shout out to you all. You all, that's right. Miss Haley said you all hit a home run. Yep, a grand slam home run. Everyone got that correct. Well done, well done, well done. All right, we're on the mail system. Let's do it. Of the following answers, which best describes the encounter? A, 54150, circumcision. No, I'm just going to just call the um, code and that's it. A, 54150, B, 54160, C, 5416063 modifier, and D, 54150. A 10-day-old newborn male undergoes a routine circumcision using a Gomco clamp. The procedure is performed without complications and no revision or repair is required. Okay, coders, what say you? Is it A, circumcision using clamp or other device with regional dorsal penile nerve block? B, 54160, circumcision, surgical excision other than clamp device or dorsal slit, 28 days or less? C, circumcision, surgical excision other than clamp, device, or dorsal slit, older than 28 days of age? Or D, circumcision using clamp or other device with regional dorsal penile nerve block? What say you? Go ahead, type your answers in the chat. And yes, A and D are saying the same thing, but the difference between them is the 52 modifier. I love the pace of these answers. Keep going. Okay, coders. I am loving this participation too, Miss Beth. Outstanding job, everyone. For everyone that took the initiative to answer, hats off. Okay, this is what I did. I inventoried, and there are only two things that I needed to capture. We had a circumcision, and this was done via Gomco clamp. Now, if we only captured that kind of eliminates a lot of noise, right? And we can hone in on what happened. This patient had a circumcision and a clamp. They used a clamp. They did not excise the patient. They used a Gomco clamp. This is something, and I'm thinking this was done in the office. I used to work in urology. Yes, and this was the procedure that I did not like because it was carried out in the office. Yes, they used the clamp, and sometimes, especially if the infants, and why would they do it in the office as opposed to in the hospital? Sometimes, and I'm going to give you the example of a breath. So Jewish patients, it's important that they have a breath carried out by the person, the designated person in their faith to do it. So generally, it's not a doctor. But when the baby has some problem, like they might have a congenital defect like hypospadias or something, maybe hydrocele, those are hypospadias is, I'm not going to go into that, but you all will see that that is a common procedure that we code for is staged. Also, maybe hernias or their testicles haven't descended, something. But anytime that happens, the birth is carried out in the doctor's office, and I don't like it. So they take this clamp, they clamp it down, often it's no anesthesia, often. Definitely not dorsal, just to let you know that. Yeah. Okay. So, because I said this clamp is not an excision, it's a device that they just, punch down on the tissue and remove it. So, it's not an excision. So, we're going to get rid of the circumcision surgical excision codes, right? So B is coding for the excision, and so too is C. It's clamp. A and D are coding for both. Now, what's the difference? Well, one is using modifier 52 and the other is not. So what does this modifier 52 mean? Well, this modifier 52, according to guidelines, says and this is the MCG that I'm using. And for circumcisions, modifier 52 is used if circumcision is performed without a nerve block. Is there any mention of a nerve block? Was a nerve block administered? Okay. Good job, Sheila. Good job. Anybody else? Okay. That's right, Melissa. Yeah, there's no mention of a nerve block. Nope. So guess what? The answer is no. So if it's without a nerve block, then we use modifier 52, right? And if you look at the code, 54150, it says it in the parenthetical guidelines right here. So I advise you to kind of make it kind of stick out or just practice. If you just keep practicing these, you're going to get it. So we're going to eliminate A because there was no nerve block. And D, that's our answer. Well done. Well done. That's right. That's right. Somebody said also if it's not documented, it did not happen. Absolutely. We only code what we see. We only code what was documented. Absolutely. Good job. Welcome, 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 Mary Lane. All right, so we got another gem clamp without block, and that's anesthesia. Use modifier 52. Okay. All right. Now we're going to move on to the female. So yeah, this is our last one, and we will go over a little bit. Hopefully you can stay. If you have to go, please definitely complete the survey, and thank you in advance. All right. Of the following answers, which best describes the encounter? As you can see, there are no descriptors. A, 59400 5815059 modifier. B, 59409 59525. C, 59409 58150. And D, 59400 59525. A 32-year-old patient has a vaginal delivery. Immediately after delivery, the physician performs a total abdominal hysterectomy due to uncontrolled postpartum hemorrhage. The procedures were carried out by her obstetrician, where she received prenatal and postnatal care. Okay, coders, go ahead, type your answers in the chat. All right, coders, because time is we have limited time, I'm going to move on and definitely keep putting your answers in the chat. Great job for those of you that did answer. It is okay. And yeah, I may have given this one away earlier if you were locked in. I know I say a lot, so I don't expect you to get everything. All right, here's the inventory. We had a vaginal delivery. Then immediately after that delivery, a total abdominal hysterectomy. And this was due to uncontrolled postpartum hemorrhage, and the obstetrician carries out the total package. What does that mean? That means that the obstetrician carried out the prenatal care and the postnatal care. So the delivery, prenatal, and postnatal care all comprise the total package. So if you don't understand that, that means that you haven't gotten to the female instruction yet. So definitely make sure you do. Now, that's important to document because we have two codes. When a patient delivers, there is a total package code 59400. This is routine obstetric care, including antepartum care, vaginal delivery with or without episiotomy, and forceps and postpartum care. So it's saying all three of those services were rendered. And if all three are rendered, you can use this 59400, right? And all three were. So we can probably eliminate a couple. We can eliminate B and C because they're both coding for 59409. This is the code for the delivery only. Like, why wouldn't we be able to why would we use this code when we have the total package code? So let's go ahead and I'm going to put all the other codes up here. And this 59409, we should just go ahead and get rid of any code that has it because there's no pre and postnatal care. And that leaves us with A and D. What is the difference between the two? Well, the difference is 5A is coding for 58150. This is total abdominal hysterectomy with or without removal of tubes, with or without removal of ovaries. Okay, well, that may have happened, right? But 59525, this is also a subtotal or total hysterectomy after cesarean. Yeah, somebody caught it. Cesarean. Yeah, this is cesarean section. We didn't have a C-section, we had delivery. So yes, this is the code that you use after as for a hysterectomy after a cesarean. So we're going to get rid of D because no cesarean took place. And our answer is A. And yes, you can code for the delivery as well as the total abdominal hysterectomy if it occurs in the same setting. And we just went ahead and pinned modifier 59 because they are two different procedures, two distinct procedures. Yeah, and if you don't know the difference, think about the objective. If you want to know, like, are these procedures related or not? If they're not related, often they have different objectives, right? So the objective of the delivery is removal or delivering of the baby, whereas the total abdominal hysterectomy, the objective is to remove the cervix and the uterus. Okay. So I like to say that, like when I get confused, I'm like, okay, what are their objectives? All right, they're different, so they're different. They're not related. All right, so just want to say, let's go ahead. There's some old things that I didn't hide. All right, so if you got that correct and you all nailed it. That tells me that you're becoming more forensic and stronger week after week after week. Hats off to you. Hats off to you. An outstanding job. But if you learn something, don't you dare think I'm not recognizing you. If you learn something, that's priceless. Somebody said, a couple of you said, hey, I had an aha moment. I did. All right, so let's look at week 14 homework. And here you go. It's on your syllabus. There are 14 steps to 14. Definitely do as much as you can. And if you're in the course, the online course, your work is placed where it should be and follow it in the order presented. And finally, I want you to know that these CPT procedures video catalog, they could be very, very gold. They're good now, and we're augmenting them or making them better as we go. So you're going to start, oh my, they are just amazing. They're getting better and better. So you guys were awesome. Someone said the bleeding was due to the vaginal birth, so why is it not related? Think about the objective. What is the objective of the vaginal delivery? And what is the objective of the hysterectomy? So if the objective are the same or somewhere related, then they're related. They're different procedures, totally different. Different body parts, right? One is addressing the baby, the other's addressing the anatomy, the uterus, the ovaries, or whatever they took out. Hopefully that makes sense. And sometimes you just got to kind of sit back and let it marinate. Thank you, Sheila. We appreciate you. Okay, so the other thing I want to tell you, I was just saying the video catalog. Look at these videos. You don't have to look, there aren't these long 3-hour videos, just the subject that you're interested in. So if we're in studying integumentary, or you are, and you just want to know about skin biopsies within code series 11102 through 11, oh, there's a little error, 107, then that's what you click on. Yeah, they're only like 5 minutes. Yeah. Thanks. Thanks for letting me know, Melissa. Okay. You guys are doing amazing. So we got some final tips. And the final tips is this class is not for instruction. So when you complete that survey, don't say, "Oh, Mrs. J didn't instruct us step by step by step." That's because you should already have that when you get here. And if you don't, we got Mr. Sandeep on Friday. Go check him out. He's going to be talking about these very same subjects or some of these subjects. You're going to be amazing. Definitely use Quizlet when you can. Never ever use an encoder while you are training to be a medical coder. Do or take that exam. Don't use it ever at all. You can use it after you pass. This will build up your proficiency. It will. And yes, ChatGPT is an encoder. Never use blind process of elimination. 2026 guidelines always takes precedence. So yes, we do have some older videos. And if you're curious, hey, which guideline should I follow? Always follow your current guidelines of 2026, right? And if you have Practicode and you want to do that, purchase it after you take your medical coding exams. It will be a conflict of information. I'm telling you, because they're focusing on real world, and some of the real world guidelines are not being followed on that exam. The only guidelines we follow on the exams are the CPT ICD-10-CM. No, I mean there is one or two real world guideline, but we'll tell you what it is, but most of those guidelines are coming from that book. All right. So that's that. Oh, here's another one. Never make study questions using Chat GPT or any other AI, because 9 times out of 10, if it's guideline based, it's going to be wrong. I'm sorry. Even though Chat's getting better, but they're not there yet. You can't trust it yet. Okay. So what they can't do is they can't read like parenthetical guidelines. It can't read certain ones. So if it's giving you the wrong answer, you're learning wrong. You're putting yourself at a disadvantage. And somebody said in the chat that Mr. Sandeep's class on Friday is amazing. Indeed. Oh, let's not forget about Miss Haley's class on Monday. Miss Haley, you should be like, hey, wave, Mrs. J. Definitely on Mondays, ICD 10 CM. Please, please, please. That's also an amazing class. And finally, we're here. Please complete the survey. Please. Miss Mills has a survey link. Can you put it in there again? She's way up there. Thank you, thank you, thank you. And I just want to thank my team. I want to thank Ms. Mills, Miss Haley. I'm not sure, I don't think Mr. Sandeep made it, but we want to thank you too, Mr. Sandeep. I do miss you. And I want to thank my interns, Miss Beth, Vina D, Case, and Star Wars Girl. Outstanding, outstanding job, everyone. And I want to thank you, coders. You come in every single week. Every week, you show up, you show out, and you're getting stronger and stronger and stronger. And some of these questions were not easy. Some were, and some were not. And I can see your growth and your questions throughout the chat. Remarkable. Keep them coming. Keep them coming, keep them coming. Someone said that they made the mistake of using practice. It's okay, it's okay. You know what? You're going to be okay with that practical. Just don't do it until after you've passed. And if you are an intern, you don't need it. And if you are an intern, you definitely don't need it because you have all the practice questions from your MCG. All right, Vanessa, welcome new member. That's right. Oh, there's Mr. Sandeep. Hi, Mr. Sandeep. All right. And Miss Haley said you all rocked it. Ms. Beth said both the ICD 10 CM classes on Monday and the Friday CPT classes are amazing. They are indeed. And I just want to thank all of you coders just for coming in again, showing up, showing out. And we do appreciate you. We do. All right, the Discord information is on your syllabus. And if you need help, we're here. Yes, we will see you next week, Delicia.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. 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 AMCI.